An opportunity for discussion. This is the 15-Minute Wonder on South Waves Radio.
Hello everyone, thank you to Dr. Chan's Minor Ailments Forum again. So in the last few weeks we talked about diabetes a lot, so I'm thinking about talking something completely different. Now one of our audiences actually requested a topic on flu, especially man flu, and I found it really interesting. I just want to clear the myths of whether man flu actually exists or not. So before we get into it, I would like to say thank you for the request, and I'm more than welcome for our audiences to send me requests on topics that are interesting or things that you want to know. Okay, so before we go into talk about man flu, I just want to clarify differences between cold and flu. So during the consultations in my surgeries, quite a lot of patients come in and say, I think that I've got flu, or I've got really bad flu during the weekend. Now, but when you actually ask about the question and hear how they actually progress, they appear to be having a very, very bad cold rather than flu-like symptoms. Now, so I just want to clarify the differences. So when you think about cold and flu, you will think about symptoms like cough, runny nose and sore throat, but they're actually caused by different viruses. So do you know there are 200 different viruses that potentially can cause a cold, but only 3 viruses causing flu? So the interesting thing is cold tends to be a progressive kind of illness. So you will start off with maybe just feeling a little bit unwell with a little bit of headache or runny nose, but tend to be clear. And then you might start off with sore throat for a few days, and then it slowly progresses to a combination of symptoms with a cough or maybe feeling achy everywhere, and your temperature might be a bit up. Whereas for flu, they tend to come on really quickly. So you might contract the virus like now, and the symptoms can present on the same days or within 1 to 3 days. And they tend to be more severe, for example, with a sudden fever, your muscle aches everywhere, and you need to lie down to rest and might even have a chesty cough. I remember once I saw a patient who really had flu, and he told me, I was so unwell that I couldn't even manage to pick up 20 pounds on the floor, even if it's free for grab. And then that's a really good description of how flu actually feels like. It's extremely unwell. Well, but the good news is both flu and cold tends to get better on its own, and it generally get better from 7 to 10 days from the onset of the illness. But I must say that the people who are at a higher risk of contracting complications, for example, the people who suffer from chronic illnesses like diabetes, high blood pressure, or had a stroke before, or someone who is older than 65, and children, so they're more likely to get complications. So it is wise for them to, number one, to have flu jab, and also number two, if you feel like you're having a flu, go and see a doctor and for them to have a look at you. So now we've clarified that, so we can go on to talk about man flu. So you might hear it from your friends saying, John had man flu last week and he was really unwell and he couldn't go and play football, for example. Well, so I just want to clarify what is man flu. So I looked on the internet, and the definition for man flu is very interesting. They said cold or similar minor ailment as experienced by a man who is regarded as exaggerating the severity of the symptoms. Now, is it wrong? I think maybe we need to give the guys some credit about when they're feeling unwell, how they actually feel. Obviously, this is not a medical diagnosis, and the definition is just someone that wrote online on like Urban Dictionary. But I think we need to look into it and see whether guys actually suffer more when they get cold or flu, or is it just a myth. There's been many studies that are done on a topic of man flu by really famous universities. So I'm just going to talk about a few of them to see whether man flu actually exists or not. So the first study that I want to talk about is a study that's done by Harvard University. So they basically conducted this study on genetically modified mice. So they've got female and male mice, and they realized that when they give these mice the same virus, let's say same respiratory virus, the female mice tend to do a lot better. The conclusion of the study is that the female mice does better is because they have estrogen, which help them to fight the respiratory infections. So just getting into a little bit more details about this study. So it was presented at the medical journal Life Sciences, and they found out that an enzyme called nitric oxide synthase 3 actually helped to cause the release of estrogen, and in a guy or in male species they tend to lack this enzyme. So they also try to give some male mice some estrogen to see how they fight respiratory viruses. And those actually got extra estrogen fight infections much better than those who lack estrogen. So that's very interesting finding. However, although this seems to be a positive finding, you can't still say that, man flu actually exists, because this study only tested on mice and not human. That's number one. And number two is these species were given a respiratory virus, like a bacteria as such, but not really given flu virus. So how can you judge that man flu actually exists? You probably can't. But this is interesting anyway. There's another study that's done in Durham University, which you all know is a local university in England, and they found out that males suffer more than female when they have a cold or flu. It's because of the temperature receptors in the brain. So by going into further, we need to kind of step back a little bit and think about what actually happened to our bodies when we get an infection as such. So the first thing that will happen to us is your body detected something foreign or like a virus, and we know that we need to get rid of it. And by doing so, a chain reaction will occur, and the end result is our temperature goes up, for example, having a fever. And by increasing the temperature, it would tend to help to fight off the bugs that we've got in our system. But apparently, men have more temperature receptors, which is called the preoptic nucleus, and this is bigger in men than women. So if that theory is correct, then that means that when men are ill with the same virus, they tend to run a higher temperature than women, and they tend to feel worse. As you all know, when you're running a temperature, you don't feel great. So apart from the above two theories, I've also looked on the internet to find other theories that support man flus actually exist and why they suffer more. And there's been a study showing that the potential live fast, die young lifestyle in male species might mean that in evolutionary terms they have failed to build up the immune systems like the females do. So this theory is actually came out from University of Cambridge. So they came up with that by using a mathematical model to calculate the likelihood. And you can imagine that if you live an adventurous lifestyle, then that means that you're more likely to expose to people and different environments, and hence exposed to more diseases. So in an evolutionary term, the male species tend to invest more energy in maintaining the ability to reproduce, even when they're ill. So you can imagine if you don't recover properly from the first illness, then you're more likely to be reinfected much quicker as well. This study also implied that the Darwin's theory play a very important role in this, because they said that an increase in male susceptibility or exposure to infection favors the spread of the pathogen in the whole population, and hence the species who tends to be able to fight infection or have higher resistance to infection in both sexes will tend to be select and survive. And this is actually a quote from one of the doctors who's involved in this conduction of the test. Bottom line is that there's no study in this world that can 100% prove that man flu exists or not, but there's some evidence supporting why men feel it a lot more than women, and hopefully there'll be more studies coming up in the next few years to prove whether man flu actually exists or not. Now, with the remaining few minutes, I just want to spend some time to talk about a new flu that came out back in 2 years ago, I think, from Saudi Arabia. So as you know, several years ago, there was SARS in China and Hong Kong that was associated with a lot of deaths. And but now there's a new flu that came out in Saudi Arabia called Middle East Respiratory Syndrome, or another name for it is MERS, MERS. Well, it is believed that MERS is originated from an animal source and most likely from camels. The first case was reported in Saudi Arabia back in 2012, and since then, in May 2015, the Republic of Korea has also been investigating an outbreak of MERS as well. It was believed that the first person that contracted MERS, who are actually in Korea, contracted it from the Middle East when he was traveling there. It is caused by a virus called coronavirus, and it causes a very quick response. Basically, if you contracted this virus, you will feel acutely unwell, and it only happens within several days that you contracted it. They said the average incubation period of time would be 5 to 6 days, but it can span from 2 to 14 days. So like all the other flu-like symptoms, you will get the fever, the cough, and the shortness of breath. The scary thing of this one is there's no real treatment for the MERS, but the scary thing about this virus is that the reports show that 3 to 4 out of the 10 that contracted with this MERS virus have died. Well, the interesting thing is that I've heard about this news via Facebook because I've got loads of friends who are still living in Hong Kong and in the Oriental regions, and they're all talking about MERS in Korea because quite a lot of people who live in Hong Kong or China would go to Korea for traveling because it's just right next to each other, and they're now planning, well, should I actually go because I'm worried about contracting a virus? And they do also worry that it might be another reenactment of SARS in Hong Kong and China, so it's quite lethal. But with all viral infection like that, or any illnesses really, prevention is better than treatment, especially in this case that there's no specific treatment for MERS or SARS. It's mainly just supportive management, like, maintaining the fluid and making sure that the nutrients are going into the person and so on and so forth. So the bottom line is that we need to make sure that we are doing everything to prevent the contraction of this virus, and the main thing is make sure that you wash your hands for at least 20 seconds. It's not literally just wetting your hands and put the soap on, rub it and then wash it off, as the germs are so tiny that you need to make sure that you get to every single tiny little space in your hands to remove them. And of course, the old school saying, if you're going to sneeze or blow your nose, make sure you've got tissues to cover your mouth and your nose. As you can see, that these tiny viruses are just going to travel through the air in the droplets that came out from your nose or mouth. I think the third thing is just to avoid personal contact, like kissing or sharing personal belongings, like using the same cups and so on and so forth. At the moment, there's no restriction of whether someone can travel to, for example, Saudi Arabia or Korea because of the outbreak of MERS, but we just have to be careful and just prevent ourselves contracting any viruses, and that should be sufficient at the moment. So my advice for you would be, if you have cold or flu-like symptoms and you feel that it's lasting longer than it should be, for example, around 7 to 10 days you'll get better, but it's actually getting worse and worse, and I would highly recommend you to go and see your doctors to see is it just cold or flu, or is it something else, because especially if you've got diabetes, high blood pressure or any other chronic illnesses, you're more susceptible of getting any complications from flu and colds. So I hope that you found today's topic interesting and also educational in a way, I hope. Please feel free to contact the radio station if you would like to know anything in particular, and I will try to answer your questions. Next week, I'll talk about high blood pressure and how to diagnose it and how to manage it. Until then, have a very good week, and we'll meet again next week. Bye-bye.
An opportunity for discussion. This is the 15-Minute Wonder on South Waves Radio.